like operationalizing this like a model. For example, for institutional factors, we developed some, we approved some bylaws at the university, and we have an equality committee, and we supervise the quality of electronic courses by faculty members. For instructional design factor, we had some faculty development program, mainly online faculty development program. And for example, evaluation factor, we developed some evaluation tool to evaluate online courses by students. So there are more examples. I don't have much time to explain all the factors, but let me just mention two important things for this model. It's mainly concerning quality enhancement and like quality assurance. Actually, as I mentioned before, this model has two primary functions: enhancement and quality assurance. For like quality enhancement, it can be used to foster quality improvement in virtual institution according to all those 7 main factors that I explained. But also it can like enable virtual institution or virtual education center to identify what they should measure and how to measure to determine their strengths and weaknesses and to have plan for improvement. So at the moment of like coronavirus crisis, we can use these factors and pay attention to some of those sub-factors to have quality enhancement, to have improvement in our education, because we don't know what will happen in our next semester. And are we going to have more virtual education for our students or not? So thank you very much for your patience.
Thank you very much, Dr. Yamani, for this important subject and great presentation. Thank you for all speakers. Now we open the questions and answers for 10 minutes. Please, anyone has any answer, any question, can type it or can speak. Okay, I have one question for Dr. Shabih. Dr. Shabih. During the pandemic of COVID-19, there are many clinical trials had been done. How can you evaluate these trials from ethical point of issue, as we know that the ethical issue is very important in clinical trials?
Right. Most of the trials that are carried out after approval by ethics committees and institutions board review, which are institutional character. I think what is happening is because of the acute crisis, a lot of things are not exactly according to the books. So sometimes they are following the pattern, which is already set, the paradigm which is established. Sometimes they are moving away from the paradigm. But most of the clinical trials which are being conducted are being acutely monitored by different groups. For example, in the field center of bioethics is very potent. They are watching every move. I don't have exact figures, but research is going on these particular trials, like drugs, for example, or vaccines at Cambridge, for example, is one place, and many other labs. The point I'm making is that one has to follow the guidance, the rules which are established. And for example, in terms of ethical research, established principles on human activity, human research, the volunteers and subjects and patients established. Nothing new about it. It's been there since the times of Helsinki Declaration. We keep modifying it all the time. So I hope they are following it. Thank you.